tell you, I'm Terry Lohman. I'm co-chair for UU's for Just Economic Community. And tonight we're screening the movie Power to Heal. And afterwards, we're going to have a discussion. We have a doctor from Chicago and we have a psychologist from Massachusetts to speak to the issues that are brought up.
For most of America's history, a system of racial segregation dictated every aspect of life. In no area was this more true than in healthcare.
You think about the civil rights movement, you think about housing, public accommodation, education. But I think the story hasn't been told often about what happened in terms of the institutions of medicine. So that's an unrevealed part of the history.
In 1965, as the civil rights struggle escalated, Black Americans were in the streets fighting for justice and equality. They were being attacked and killed. But a different kind of violence was taking thousands of Black lives every year. Segregated medical care was a brutal reality for Black Americans.
Negroes had one ward. If you were dying from cancer, if you were there to have a baby or whatever, you're on the same ward.
Everything was segregated, not just the hospitals, but physicians' practices. I was the only Black pediatrician in the entire state.
People were dying as a result of that segregated system.
The 1964 Civil Rights Act tied federal funds to desegregation. Now Medicare, with its promise of federal funds, created an opportunity to end the shocking inequalities in medical care. This is the remarkable story of how civil rights activists and the federal government, working together, desegregated thousands of hospitals practically overnight, bringing life-saving care to millions of Americans. This little-known story reveals the role of countless people who never took center stage, but whose shoulders we stand on.
I just wanted to share my initial thought is that the racism that I've seen in this film was probably some of the most egregious that I've seen anywhere in my travels. It's a very shocking video of inhumanity. Tonight, though, we have with us Dr. Howard Ehrman, who has lived some of this actual segregation in the hospitals. He has been the former Chicago Assistant Health Commissioner in former University of Illinois of Chicago, Assistant Professor of Faculty of Family Medicine and Public Health, and co-founder of the Little Village Environment Justice Organization, LVEJO, and the co-founder of People's Response Network, PRN, and co-founder of Mia Velia Neighbors, MVN, among other accomplishments. And one of those, I think, is the experience he has with the actual racism that existed at that time. He saw it firsthand, and we're so happy to have him with us. And Dr. Ehrman, I think we'll just start in right away, unless you want to have a few words before I ask the first question.
Go right ahead, Carl. Thank you for the introduction.
Okay, I hope I covered it all. But Anyway, one of the things I saw was that there was deep-seated racism. What has happened to race, class, and gender medical care and health care since Medicare was implemented 58 years ago?
I think all of us probably lived or were alive and old enough to probably experience the difference that Medicare did bring. That was an incredible step forward, preceded by really a century of struggle, led by African Americans, certainly since the Emancipation Proclamation, led by many different people, including A. Philip Randolph, who has an enormous role to play in this piece of legislation, who we discussed with President Truman, and actually discussed with President Roosevelt when he threatened to a massive march and occupation of Washington, D.C. in 1943 that led to major progress, in civil rights. So what happened initially, of course, the Medicare bill was passed in 1964. It was not funded until 1965. And at the same time, another part of the Civil Rights Bill, it was just as important. And that was the funding of what initially were called community health centers. There are now over 14,000 of these community health centers. They are set up to serve primarily poor and working class people, particularly people originally in the South, although the second one was in Boston. And they play a major role for 30 million people, about 9% of the population. Certainly, the Affordable Care Act was a step forward for millions of people. But I think we have to be realistic, and I'm sure we all have seen what's happened. So once 1965 happened, there was major progress made, not just on healthcare, but certainly previous efforts by civil rights movement, by workers, by many people in the 19th century that led to some of the greatest advances in people's health and longevity. Clean air, clean water, better housing, all these struggles started in the 19th century. So people got healthier as a result of these. And there's a major difference between public health efforts, like the ones I just mentioned, and healthcare. That was codified by the Johns Hopkins School of Public Health, the first school of public health in the United States, and the AMA working together at the very end of World War II to completely divide public health from medical care. This was a compact between the two of them that still stands today, over 105 years later. In other words, doctors are not trained in public health. Doctors are trained to take care of patients in settings like hospitals and clinics. This is enormously important and has led to the deaths of thousands, tens of thousands of people during COVID, as one of the recent examples. So there were major advances that were also accompanied by the struggle for affirmative action in the health sciences, which led to the admission and training of tens of thousands of African American, Latino, Native American, and other people of color into medical schools, nursing schools, etc. This is, I guess, no coincidence, is the 50th anniversary this month of me graduating from what is still the largest medical school in the United States, the University of Illinois at Chicago, where we had 275 of us, and we were the first class that really represented the results of affirmative action. So our class was about 40 to 45% not white. Also, we had a much higher percentage of women of all races in the class. So this progress continued in terms of both people getting health care in hospitals, the opening of thousands of these community health centers in neighborhoods and thousands of rural towns and counties that had no formal health care before 1965. Certainly, this was very prevalent in the South, but that was not the only place. It was true in the Southwest, it was true in the West, it was true in the North. So this continued. There were other factors that are very important, and that factor has to do with what the Black Panther Party started, soon joined by the Young Lords and the Young Patriots, particularly in Chicago, where the largest type of healthcare was given in a coalition of 9 organizations that I was part of before I was a medical student, working with Fred Hampton and other people, to not just set up free clinics before enough of these community health centers got set up, but to go out to the people. This is the basic tenet of public health. You go out to the people. You don't tell people to go to a brick and mortar facility. So these were all positive things. We can certainly talk about more if people want to. But this lasted into the 1980s. And by the end of the 1980s, we started to have a plateauing in every factor that we can talk about. Every healthcare indicator in terms of different types of diseases, for morbidity and mortality, and in terms of the admissions in particular of African Americans into medical school and nursing school. For the last 20 years, we have gone backwards faster and faster. I walk through my medical school corridor about once a year. And in the last 20 years, there's been a decrease in the number of Black students in still the largest medical school in the country. And the majority of the Black students are now sons and daughters of Nigerian physicians and scientists who live in Chicago, not African Americans. This has been accompanied by a rapid decrease in longevity and an increase in all types of morbidity and mortality among African Americans and Latinos and Native Americans in particular, that accelerated tremendously during COVID, where an unheard of statistic in the world, actually, where Latinos lost 3 years of their longevity over the first 2 years of COVID. African Americans lost 2.7 years, and whites lost about 1 year. This had never happened before in the history of the United States to this extent and degree. And now I think, and I hope that both Angel and Ana, my dear friends and radical elders, will speak to this. Now what the issue is the destruction of Medicare. Medicare never provided complete, anything close to complete equity by race, class, or gender. If it would have been written differently, the way that my great-great-uncle, who was a US congressman under Roosevelt, originally wrote it with 3 other congressmen and senators, to be much more like a national health system where nobody paid anything. This was in 1934. Of course, that was rejected when Roosevelt got enormous pressure from the AMA and from insurance companies. Then life would have been much better. But what were the problems from the beginning of Medicare? Well, we have millions of people who do not have Medicare B who qualify for it because they can't afford to get Medicare B. Everyone, as you know, gets Medicare Part A free as soon as you turn 65 and you apply for it, either at the Social Security office or now online. But to get Medicare Part B, you have to apply at the same time and you pay for it. This is a huge factor in race, class, and gender inequity that's existed since Medicare was implemented in 1965. The other thing, of course, that's happened with Medicare is the question of massive privatization, where now, beginning in 2022, the majority of people who have Medicare are now in privatized plans, which seem enticing until you get sick. And once you get sick, either as an outpatient or an inpatient, you are very much more restricted in terms of what hospitals you can go to, what care you can go to. This restriction, again, is not equal. It's based on race, class, and gender. So I think there's many factors to why this is all happening. But one thing I would really encourage people to do is watch one of the best documentaries ever made that I know of that just came out in the last couple of weeks to explain the massive robbing of wealth from African Americans, not just in Chicago, but the Chicago literally wrote the playbook at the federal level for redlining, for contracts, for covenants, and everything else. This is a 4-part series. It's free. I'll put it in the chat, but this is enormously related to what we've been talking about.
that adage that the rising tide raises all boats. And that's what we saw. Health improved when African Americans' health was accessible. So, you know, it's not a losing game, I think. Some people might fear that if African Americans get something, it's going to take something away from the general public, but that's not really true. So, but again, as Dr. Ehrman said, um, it's open. The floor is open for any questions that you might want to, you know, ask at this point. Dick Burkhart, you have your hand up.
Yeah, I was just a student in the 1960s, and I, you know, saw the newsreels about what was going on in civil rights in the South and things like that. But for whatever reason, this whole story about integrating the hospitals, I didn't even know about. So it seemed like there was some things that must have gotten into the big media and other things like this that were important, but didn't get into the big media because I wasn't into all that stuff that time. You know, just being a student, I was focused on the other things. So why do you think that happened where this did not become a big, you know, something that was very important, did not actually make the national news as much as other things, like the voting rights?
Well, I don't know. You know, I was 16 years old when the bill was passed in 1964 in the spring, right before my 17th birthday. I think I was a junior in high school. So I'm not really qualified. I don't know if Carl, you know, has an opinion. I would just say that the media always, you know, has been on the side of the wealthy, white, and powerful capitalist. That's what the media has always been. It's worse than ever, but it's always been that way. So I think selectively they decided what to report on.
I do remember negative reporting on AMA, though. I don't remember any of the details, but I remember it was very heavily criticized. So maybe it did get somehow through that channel, if some of this maybe came forward. I don't know.
One of the things that might address the issue you're concerned with, Dick, is that the media is one of the vital tools of oligarchy and anarchy. You know, if they can control the media, and you know, they have a way of brainwashing everyone else. Now, we may know about the discovery of ALEC, ALEC, the the group that writes bills for congressmen, and they, you know, grease their palms of their hands, and they sell it to politicians. And the politicians, without revising the bill that Alex has, you know, written for them, will implement that in their districts. So the media, we can't expect them to be on our side at this point in time. Um, so uh, that doesn't seem to be changing, and it may be a long time before we get Walter Cronkite again.
I think you can see it on the coverage of the Gaza war right now.
Yes, very much so.
Yeah,
And
Mary.
they have us conditioned.
Oh, Mary has her
Let's
hand
see.
up.
Yeah, Mary. Yeah.
It's very important to dig into this history because, of course, you know, it's so relevant to how things got structured. And one of the things that I've always liked about the Medicare story was that it was an opportunity for government to make a policy that actually made a difference. The thing that I did not know about the Medicare story was that the AMA was so resistant to it. So my question is, has the AMA ever apologized?
No, the AMA doesn't apologize. The AMA, so, you know, the AMA right now is refusing, despite multiple protests. You know, you may know it's based here in Chicago. We've had multiple protests about Palestine to declare, you know, Palestine is genocide. Just like it talked about Ukraine, but of course it doesn't want to do that. So the AMA is still playing overall a negative role. It has certainly become relatively a little more racially diverse and also gender diverse in terms of some of its leadership. But its policies, to be honest with you, are not a whole lot better than what you saw in the movie.
Paul Beath?
Thank you. Thank you. Yeah, thank you for being here, Dr. Ehrman. And I actually, when I, saw the announcement and your little bio in the newsletter, I actually, I'm glad I looked up your bio a little bit because I had you confused with another physician, who has a similar history. That was it's oh my gosh, William Bronston. And he's one of the kind of early, one of the founders of like Physicians for a National Health Program. And I heard there was a great interview with him on an excellent podcast that I definitely recommend to everybody called Death Panel. That's great content on the political economy of like the healthcare system. But anyway, he has some really interesting ideas about kind of once we get some kind of universal healthcare to go even further and create like a system based on, these principle that he talks about of lifetime care. And are you familiar with that, with those, that kind of idea of like having a really decentralized, but very community based kind of delivery of public health services?
Yes.
Super. Well, thank you.
Yeah, I mean, I think this is thank you for raising that point, and I think Anna is next. She's had her hand up for a while. I think what's happened is, unfortunately, that there was a trade-off. This was not the result of Medicare. This is just the result of how capitalism and neoliberalism in particular works. So what happened in the mid to late 70s, there started to be large debates inside the American Public Health Association when there used to be a lot more public health workers. So there'd be up to 15, 20,000 people going to these annual meetings in the fall. And the debate was, if the government keeps giving money for these community health centers to public health departments, then they're going to take the money away from traditional public health, which is to make sure the water is clean, air is clean, et cetera, et cetera. And unfortunately, that's what's happened. It's not the fault of the community health centers, because there's plenty of money to go around if we weren't spending $100 million a day, killing Palestinians with our bombs. So basically, there's plenty of money. But what the government did between 1980 and right before COVID is to cut 100,000 public health workers. Now, public health workers are primarily working for cities, counties, and states. The CDC did have cuts, but the CDC is not a public health system. It doesn't do anything except do investigation and guidance. So this was a huge problem because now we have almost no public health system left. And despite giving billions of dollars during COVID, 95% of that money was privatized. by cities, counties, and states. So we're not much better off in public health than we were then. So the ability to have a decentralized public health system and an integrated medical system exists only one place in the world for 11 million people, and that's the Republic of Cuba, who has absolutely done the most amazing job since the nation states were founded centuries ago, where every doctor and nurse work as a team, live in the neighborhood that they take care of. They have a certain specific geographic area where they go door to door every day. They have a clinic, et cetera, and they implement public health, whether it's getting rid of water so there's no dengue and other mosquito-borne diseases, or giving vaccines or whatever. So there is a model for this. It does exist, but that's not a model that's ever existed in the United States. And that is something we have to fight for at a very localized level, but it also needs lots of money for health instead of bombs. But I think Anna was next. Yeah.
Yeah, Angel Roman.
No, I was saying my husband, Angel Roman, walked away for a moment, but I did want to say a few words about our, we're New York City retirees and our involvement with healthcare as part of the city retirees who have been fighting to continue with the great, excellent healthcare we can get as city employees. But what's been going on recently is, and that's not only in New York, but in other states and in other cities, is that they are baiting and switching us from our excellent healthcare, which is traditional Medicare, into the Medicare Advantage program. And so we have started to do some, I got involved recently, although I do, have some experience in public health, working for New York City, the Department of Health, and later on the Human Resources Administration. But I wasn't so involved in terms of, I didn't know what was, I really didn't know the difference between Medicare, traditional Medicare, and Medicare Advantage, but we all knew that all of a sudden we were going to be, it was going to be costing us money. And I had volunteered for something called the Medicare Rights Center in New York for about 5 years. And all I did during that time, which was the work I did after I was retired as a public health educator around the Affordable Care Act and the Obama, I started to answer questions about how do you get your Medicare? When do you get your Medicare? Why am I not, why are they charging me for this? Why are they charging me for that? And so I learned quickly that Medicare Advantage is very different from what I had. I had Medicare, but I had the traditional Medicare, which pays for 80%, and then 20% you have to get it paid through another insurance, a supplementary insurance. But with Medicare Advantage, which is Part C of Medicare, Medicare has Part A, Part B, Part C, which are the Medicare Advantage plans, which are privatized and are they're privatized. And that means that they are run by private health insurance companies like Humana, Health First, United, United, I forget, the big one now that is in the papers because their stocks were going down. But anyway, my point is that I started to get from on the volunteer, getting questions about why they were getting denials. Why they were getting denials for certain types of procedures. And it was very distressing for some of these people. They would get outrageous out-of-pocket costs, and they didn't understand. They didn't understand how Medicare Advantage worked, but it was very hard because they were. Healthcare can lead to bankruptcy. As a matter of fact, it's the number one reason why people go into bankruptcy. but I think I'm going a little bit out of my comfort zone. I needed to really talk about the work as a city retiree that I've been doing the last 3 years or so. And that's how I met Howard, I think. But the fact was that we were very distressed when we were told that we were not going to be continued in our regular traditional Medicare, and we would not continue to get our free supplemental insurance program, and that we would have to be in networks of doctors, and they were switching us. First it was Emblem Health, then it was Aetna, and that we didn't have any choice about this. So I wasn't one of the leaders, but I learned quickly that we had to fight this. And so in New York, the New York two groups, actually, it's more complicated than that. You know, I knew I had to fight, but I didn't know what was going on, truly, until, you know, I got involved with the New York City Organization of Public Service Retirees and another group called the Cross Union Retirees Organizing Committee. These people were fighting and were fighting their unions. It was the unions at this time who had agreed to switching us to this Aetna program, which would cost us money. Although these advantage programs, I could talk more about them, but I should just keep this simple. The idea is that I wasn't paying anything now. I had the best insurance you could have. And all of a sudden they want to put me in an advantage plan where maybe I wouldn't pay for, my premium would be lower, but I would have thousands of dollars in out-of-pocket expenses. That's one. Secondly, I was also not going to have as much choice as I have with traditional Medicare. Traditional Medicare, you can use anywhere in the United States, and you'll be very fortunate because there are many more doctors who take traditional Medicare. If you're in an Advantage program, you have to use their network of doctors. And oftentimes those network of doctors are not as present, especially in when you're traveling out of state or out of the city. But the other point I wanted to make about the Advantage plan, which I already knew from my volunteer experience, was that there were a lot of denials, and only 1% of people, appealed. I mean, you know, because the process is burdensome. And for most people, they're still trying to understand, you know, it's just complicated. And so I've gotten involved with these groups, the union groups that have been fighting it. And I'm also a member of this group. You see the sign behind me called Radical Elders. And Howard is a part of the Radical Elders, and he helped us shape the work we wanted to do, which was Radical Elders focuses on the elderly. And here I am, you know, I'm elderly, definitely, but we, you know, there are other issues that as elderly we're concerned about: housing, Social Security, etc. But my focus still is health insurance, and we are fighting. We've been winning in the courts, but the mayor keeps appealing, and so who knows how long it's going to take. But people, as city retirees, there are 250,000 of us. Although I have to say, not all 250,000 are as active, but everybody, of course, is very anxious about this because if we lose the case, we will have to pay for supplementary insurance or stick with the Advantage Care program.
Anna,
Yes.
Dr. Ehrman needs to leave in a moment. Can we let him wind up, and you can talk after he's done?
Yes, definitely. Thank you, Howard, for inviting me, encouraging me.
So I think I would end with what Anna was just talking about. So I'm going to text and email both Carl and Terry the flyer that Anna, Angel, myself, and several other people created 2 months ago. It was tweaked a little bit for a labor notes conference a couple weeks ago. So I can't put it in a text because the administrative doesn't allow that stuff. But I'll text it and email to you now to both Carl and Terry. So this is the issue. If without doing a poll here of the 8 of us, if you don't have private Medicare, everybody here will have it in the next couple years, unless we do something to organize around the way that Anna, Ankel, and thousands of New York City workers are doing. This is like the privatization of the best healthcare system we have in the United States by far, which is the Veterans Administration. Every Republican and Democratic president, every Republican and Democratic Congress, since the #1 privatizer in history, William Jefferson Clinton, in his second term, massively privatized the federal government, including the FDA and many other things. Everybody here will have privatized Medicare or a state type of privatized Medicare within the next couple of years, unless we organize. So I'm happy to come back if this is something that the 2 organizations sponsoring this. But I would really, really recommend, and Anna could put this in the chat, that the National Singer Player Group that just had a seminar on this yesterday is a key organization to work with. Probably more focused on the privatization of Medicare than Physicians for a National Health Plan, which is also concerned about it, but it's not as much of their focus. So thank you very much for inviting me. Happy to meet again. But I think it's really important here that we all realize we're in this boat together and that, you know, whether Biden wins or Trump wins, it's going in the wrong direction for all this stuff. And now it'll go faster for Trump, but it's going too fast for the Democrats as well. So thank you very much. And thank you for inviting me.
Thank you, Dr. Ehrman.
Thank you, Howard,
And
for laying the groundwork. I just want to just say a couple of things anyway, that we are really working with the other city retirees. The health team of the Radical Elders is working with the other union retirees. And, we're at rallies. There's several court cases that we have won. And we've also are learning that we just can't fight just for ourselves, that we really need to let people and educate everyone we come across that that Medicare, traditional Medicare, has its weaknesses, yes, but it's still better than having the private sector running Medicare the way they are with the Advantage plans. And so we're more and more moving towards national single payer. But the thing is, how do you do this? How do you educate the people? And it's complicated. Nothing is simple in terms of healthcare. We all know that. But there's billions of dollars that the Medicare Advantage plans are just taking in, and it's not to provide us to maximize our health care, but it's to maximize their profit. Their profit, $140 billion in charges. I don't even. It's incredible. These funds are depleting the Medicare Trust Fund. And so a lot of people in New York, I wasn't convinced until the other day. I got to get connected to the New York State Health Act because they're pushing for universal coverage. Yeah, great. But if that happens in all the states and this becomes more localized in states, it will fragment the Medicare, the Medicare Trust Fund for one thing, and the And many of these state localities will do what they want to do. And there will be the protections aren't there because HS is HHS, right, which runs all of this as it is. They're like so distant. They investigated recently and they saw the fraud, the denials, and they see all the problems with it. But they just smack them in the wrist a little bit and do very little. They give them more time to continue doing what they're doing. And these people who are running these advantage plans, they're not doctors. They are private equity. They are health insurance companies. And all they know how to do is just how do you make more profit out of this? And that's a whole other workshop. And one thing I do think that you should do to become more informed, Howard said the national single payer. Definitely. These are health professionals, doctors, or just people who understand policy and how government works and are becoming more and more wise to how private equity works. So I recommend you go to their website, nationalsinglepayer.com. And then the other place I recommend are the physicians, yes, for national health programs or plans, because they have done the research in such detail. They're not the only ones who've come up with this research. The Kaiser Family Foundation, the Health and Human Services has done the research showing the fraud, the denials. This is so well documented. And so that's where we're headed, at least in our small committee, it's local work that has to be done. But you need also to understand the strategy. And what I was going to say about Physicians for National Health Programs, to contact them because they have done a lot of webinars about private equity. And I don't know what it's like wherever you are, but even in New York, hospitals are closing. And so and consolidating. And then you're in emergency rooms waiting hours for beds. There are less beds. It's just what you discover in our fight to keep our traditional Medicare, which, as Howard says, the trend is to eliminate the traditional Medicare and do Medicare Advantage. I won't say anymore because I just felt I'm going all over the place a bit. But there are resources and people out there who are doing excellent work. And what's important is to get our neighbors to understand what's going on, because most people just don't know. Yeah, I have Medicaid or have this. But even Medicaid is privatized to a great extent, so that there are the insurance companies. They have like about 20 or 30 of them that are running in Medicaid in New York anyway. So thank you for allowing me to speak. And the film was excellent. Loved it.
Thank you, Angel. Any more remarks or comments?
Well, I think I'll share something that happened to us today. Our dermatologist was sold out to private equity, and so far I've been on Medicare for 12 years or almost 12 years, and we've never had a claim denied or anything. But today my husband got a notice that they weren't going to pay the $600 and some that they wanted for the 10 minutes of a nurse practitioner doing a procedure. And that doesn't mean it's the end of it, but hassles.
Now, are you in a Medicare Advantage or traditional Medicare?
No, traditional. We have Wellmark.
And you have,
as I said, they've paid everything.
And you have a supplementary plan, that means to me. You pay an additional.
No, we have the supplementary. Yeah.
But why should we? That's still a lot of money, you know? That's why we're
Yeah.
fighting. We don't want to have to go private
Well,
ourselves.
and the reason we even took it is that it is so complicated to navigate the bills that you get. I swear they were trying to kill my parents off with the bills. You know, they get a $100,000 bill and Medicare gives them 8,000 and they're done.
Yes.
Yeah. Oh, there's a lot of work to be done on this issue. You know, there's a victory that's won, but I was always learned in social justice that you probably have to keep fighting for this and for things unless or you will lose them. So we cannot take our eyes off the ball. We have to kind of be educated, educate ourselves, and hopefully some of the suggestions you gave us, Angel, will help us stay ahead of you know, the private equity scams.
All
Well,
right.
thank you.
Thank you.
Okay. Well, have a
Thanks
good
so
evening,
much.
everybody.
Yes, radical elders.net. All right. Bye-bye.